Thank you for tuning into Brightsquid user group number 12. We're going to talk about how to lower your clinic overhead. My name is Jeff McKay from Brightsquid, and with me today is Candice Jensen, our privacy team lead from the Brightsquid privacy team. So thanks, Candice, for joining us today.
Yeah, thanks for having me, Jeff, and hello, everybody.
We're just going to talk through a lot of the processes that we can help you fix in your clinic. We'll talk about some examples of how a lot of clinics overspend. We'll talk about some of the privacy myths that may be holding you back, that clinics often kind of put in their own way. We'll talk about the cost of mail. We'll talk about the cost of fax, phone. We'll talk about email. There's a number of reasons that clinics use email. Some do, some don't. And same with fax, and same with mail. We'll also talk about a little bit about privacy since we've got Candice here. She's going to give us some examples of some things and talk us through some realities of privacy and the kind of overhanging cost of that. And we'll look at how, the totals that you can expect to save in both money and time. Looking at how clinics overspend time and money, there's a lot of standard processes that add unnecessary cost and complexity. So the challenge is, as a healthcare clinic, we're always so busy, and it's really difficult to get some time and some clarity of mind to be able to objectively look at how we're operating, the processes that we're going through on a daily basis just to get the job done, and see if there's a better way to do it, see if we're actually wasting a lot of time. And this is actually just a small sample of the processes that we come across working with clinics, and clinics have identified. Stamps and envelopes is a big one. I've had clinics come up to me in trainings that we do for privacy and say, Jeff, I save $1,000 a month now because I'm not buying stamps and I'm not buying envelopes and I'm using way less printer ink. And we'll talk about how that works out. Printing documents to fax them and mail them. We all know that when I print a document to fax, once the fax is sent, I'm probably going to go and shred that paper. And the people on the other end, once they do the manual effort of taking that off their fax machine, scanning it into a computer, they're going to shred that paper too. So we're causing a lot of waste, not just in effort and resources, but environmental footprints expand bigger than they have to be anyway. Making phone calls, spending time being on the phone, letting phone interrupt our processes throughout the day. A lot of clinics still are calling for appointment reminders, so they've got staff sitting down for the phone all day or for a section of the day, making appointment reminders. Having paper forms filled in when patients arrive. There's lots of processes around that, not just the paper cost, the time handing stuff back and forth. We don't want to have so much physical contact anymore these days, so it adds complexity. And then what do we do with that paper afterwards? Manually entering stuff from the forms can be tough and time consuming. And then, there's a lot of things that we do that don't have to be done. We have clinics that work on collecting patient information before patients come in terms of what's the basis for their complaint, why are they coming in, what can we find out beforehand, and that'll help advance the doctor, the clinician in that encounter so they can start a little bit further ahead and use a little bit less time in clinic. And then, appointment preparation, that kind of comes back to that. How do we help our patients be prepared to show up and participate in a meaningful way? Also, one big thing that we see is trying to align schedules. I'm sure we've all been in appointments where they've been interrupted because the doctor has been waiting for a phone call to come back from a specialist maybe or someone else, and the phone call has come. We can finally talk to them. I go, oh, hold on, I'll be right back. Hold that thought. We lose continuity in that appointment. We spread things out too much. It breaks up the day a little bit more. If we don't have to talk face-to-face, we can use alternate means of communication, and that frees up our time. Before we proceed, let's just kind of get a temperature check. We'll have a couple of polls today. So does your clinic still use some of those processes that we just reviewed? All right, I'm going to close that, and we're going to share the results. So there's a couple clinics that aren't doing any of those things. So that's really good. That's kind of the goal of where we're trying to get to so that we can all operate more effectively and efficiently. Candice, you've got a lot of experience working with clinics explaining this kind of stuff. The first myth we have, and we talked about this in the last user group, which was quite a popular one, came up for a lot of questions. Fax transmission is compliant and safe. Can you just explain the facts here?
Yeah, you bet. So you're right, Jeff. We did talk about this a few weeks ago in more depth, and really the takeaway for me was that if we have another option of using another method, that would be preferable. little experience. A colleague of ours was in the hospital the other day, and she overheard the pharmacist talking about how they had just faxed the wrong clinic with sensitive information. Breaches are so common in this avenue. Yes, the OIPC accepts fax as an acceptable communication method, but there are so many variables that have to be met in order for it to actually be compliant. You know, the right number has to be dialed, the right people have to be on the receiving end. And it really is true that hundreds of privacy breaches a year are caused by misdialed faxes. So easy to
I would suggest it's probably thousands rather than hundreds.
Yeah, probably.
Yeah, the other one, you know, people think mail is fully compliant and safe. So what are some of our thoughts and experiences around that?
Right. So if fax isn't ideal, then what about mail, right? I have heard personally of at least 2 breaches in the last year that I can think of that involved mail. In one instance, a file label was printed and affixed to the envelope rather than the shipping label. And then the wrong label had the patient's personal health number, the date of birth, the doctor's professional ID, a file number. So a lot of information that shouldn't have been on there. And the breach wasn't even discovered until the patient's mother got the envelope at home and then phoned the clinic. And, you know, she was clearly upset. So however many hands that envelope passed through, they all had access to that health information. And then a breach report had to be filed with the commissioner, policies revisited. I can think of another instance. There was a welcome package also for a cancer treatment center, and it was sent to a patient's ex-wife because the address hadn't been updated in Netcare. So the patient, of course, was horrified to get this call from his ex, who opened the mail, discovered his condition, and again, there was harm done to the patient, the clinic's reputation, a breach report had to be filed. So don't get me wrong, mail is an option, but there's definitely things that can still go wrong.
This is one we hear a lot. People say, well, I've got this encrypted email service. And encryption is a part of compliance, but it's not the full story. So there's a lot of other things that have to be included. Auditability is a big one. We have to be able to track who's seen it, where it's been. It has to be encrypted in motion and at rest. So a lot of times if we're using something that's tied into Outlook, it's being encrypted during the send while it's traveling to the recipient. But if it's being stored in Gmail or even in Outlook in your sent folder, it's not encrypted while it's there. So that's missing a large component of compliance, not to mention the fact that we need to retain records. And if this qualifies as part of the patient record, we're going to have issues with it if it's deleted. Is that how you see it, Candace?
Yeah, absolutely. That's the point I was going to bring out as well, is it can easily be deleted by both the sender and the recipient, and that would be considered a loss of data, which is, you know, by definition a breach.
The other thing that we hear sometimes is that, you know, there's resistance to adopt digital technology as opposed to mail or something different because compliance isn't there. And that's certainly been the case, and it is the case in some cases. You should make sure the vendors you're using are compliant and are going to manage your information in a way that aligns with your responsibilities. And that's what information manager agreements are for, making sure that they've signed off on that agreement to be responsible. You know, Brightsquid built compliance first. So we actually build all of our software applications on an engine, we'll call it, that is compliant, that does manage information in that way. We actually train other organizations and support other organizations in developing and having that compliance so that they can support clinics in being more effective and efficient as well. So it's something that you really need to be sure of, but it's not a blanket statement that applies to everybody. You know, the last kind of point is that a lot of clinics are afraid to make change because there's a lot of disruption. We have habits, and a lot of times we're too busy to not use habits to follow our processes. We want to make sure that we've got a well-oiled machine and that everybody's following the procedures that we are used to. But a lot of times there's better ways to do that. And it comes back to that stuff at the beginning that 92% of people here today are still doing some of that stuff. So we want to make sure that we can do that in a way that is less disruptive. We'll talk a little bit about the cost of mail. Here's a quick story. we got a call from a clinic said, hey, we'd like to send a notification out to 700 of our patients. Can you help with that? And we said, absolutely. Yeah, we can. You just need a secure mail subscription. It's $57.49 a month. And just to send that out, it's an extra $5 because you get to send one message out to up to 500 patients a month with your subscription. So sending more than 500, it's an extra $500 per extra 500 recipients. They said, that's okay. We'll just use the mail. And we said, well, how much is that going to cost them? It cost them $3,500. So about $5 a letter. And that's fairly ridiculous considering they could have done it all for about 65. And so in the state of healthcare these days, and clinics are doing the best they can to get by, looking for ways to not spend money is a really smart opportunity. When we talk to clinics about how much they are mailing, these are some of the averages we get. So depending on your clinic, you might be up or down from there. 100 letter size envelopes a month is about 5 a day. Or 36 large envelopes, 9x12s, is about 1 3/4 a day. That adds up, and you can see that the total spend on mail is $380 to $400, plus all the extra effort of people printing stuff, folding it, stuffing envelopes, if you're doing that yourself. Now, this clinic that sent out 700 messages once, they hired a company to do it. They said, here's our list. Like Candace said in that example, we're going to want to make sure that we're careful about what's on the label and what's on the information that we send to that provider. They would be considered an information manager if you're giving them that patient data to do the mail out.
Yep, that's right. If they've got any kind of patient information, that they would be considered an information manager.
So you'll need to make sure they sign agreements and then go through all of that.
Sorry, I just had this thought that many clinics that we speak to are worried about integrating new programs, whether it's secure mail or other software, because they're worried about the time that it takes to learn it. But just as you outlined, how much time can actually be saved in the end by putting a little bit of time into learning a new program in the end is going to save you hours or days or weeks of effort.
So quick question, do you use mail to notify a large group of patients? Do you ever send out notifications, updates, anything like that through the mail to your patients? And it looks like not many people are. A couple more questions in that sense when we're talking about mail. So how many letters are you mailing each week? Are you mailing out envelopes? Is it less than 5? Is it more than 40? Where do you fit in here? Let's see where we're at with our group today. So a little less than 5. So in that range of 5, some are spending more than 20. So you're going to really want to look at your mail costs. You're going to want to look at what you can repurpose and not send through mail. Send it through secure mail if you can. That's really what it's there for. And one more quick question, just to get a sense, because I know this isn't as common. We send a few 9x12 envelope packages each month. So do you send them? Yes or no? About a third of people are, and about 2/3 aren't. That's good. We're going to talk about fax real quick. So what we hear from clinics, about 50% of clinics are using paper fax. We see 5 sent and 4 received, and the average fax packet seems to be about 4 pages. So you can think about your fax volumes. You can think about if you're using fax. If you're not using paper fax, it's going to be a little bit different. There's obviously cost to e-fax, and there's other implications as well that we can talk about. What we see, if this is true for you, about 10-20% of faxes need to be resent because they can't get through on the other end for whatever reason. We know that fax is a huge privacy risk, as we talked about. Thanks, Candace. And we know that there's extra staff effort and stress. Misdialed faxes are a problem. Investigating that takes a lot of time. It can cost a lot of money if you have to notify patients and the OIPC, that kind of thing. And fax has been implicated in a number of investigations around things like patients falling through the cracks. And for the unfortunate story of Greg Price is well publicized. If you're not familiar, go to Greg's Wings Project and check out their film. It's a really worthwhile watch to help understand some of the issues that can happen when we're not using the right communication processes. If you are falling into this average fax volume range, that means you're sending 400 pages, you're printing 400 pages to go out and you're printing 320 pages as they come in, the average cost of a sheet of paper is about 3 cents. When you look at the cost of printer cartridges and the yields that they present in terms of how many pages you can print, the total adds up to about $120, $130, depending on your volumes there. So that's all money that you can stop spending and paper you can stop wasting by printing it just so it can be shredded later. Quick poll here as well, because we hear varied responses. And again, it's going to depend probably on what type of clinic you are. Obviously, medical clinics are going to use more fax. Over 3/4 of clinics are still using paper fax. So it's an important place to look, because I kind of assume that those numbers of 5 messages faxes out and 4 in is kind of low. So take a look at what you're doing there, because there's a lot of expense that's kind of buried and we don't always pay attention to. We did the math on average printer cartridge yields, and it depends on how much ink you put down on your paper. It depends on your printer. It depends on what sort of device you're using. If you're going to Staples and buying the little guy, or if you have more of a larger photocopier, it's going to be obviously a little bit different. A lot of people, once every 3 months, once per month, once every 3 months. So people are doing twice a month. There's obviously variability, like I said, in the device you're using and the volumes that you're printing as well. So that's something to look at. How much does that cartridge cost, and how much less do I have to use it? The true cost of phone. So let's just talk about that. Appointment reminders, appointment requests. The research on this, and people have studied this because there are academics and organizations that study clinic processes, and what they found is that it takes about 2.5 minutes of staff time on the phone to book an appointment. And then appointment reminder calls, we know that a lot of them don't go through. We try to make them as quick as possible. A lot of times staff know that they sit down to make these calls, they're not going to get many people on the phone, and they feel a bit wasted. And in that case, you can go back and look at our staff satisfaction user group from last summer and understand that doing that kind of work actually makes people stressed. It physically increases the stress markers that we would find in their saliva if we were to swab their cheek. We know that voicemail is not effective or trackable. We can't know if somebody listened to it. We don't know who listened to it. To Candace's point about mailing something to the wrong place, if we're calling a home phone number especially, we don't know who's going to pick that up. And so we can't really leave any detailed information, and we have to make sure that we're leaving enough. It might just be, hey, call Dr. whoever's clinic at this number. But even just saying that, someone could find out what kind of care someone's providing, so it gets tricky. How are we documenting those phone conversations if we have to? How do we track that was done? How do we track what was said? How many patients avoid care because they couldn't get through? If your phone is shut down during lunch hour and that's the only time a patient can call in, are they just going to go to a walk-in clinic on their way home from work because they couldn't get through to book your clinic? And there's no real way to track that. Not to mention, what we hear from a lot of clinics is that phone is very disturbing and disruptive to staff process. So I talked a little bit before about what happens when someone calls in and wants to talk to one of your clinicians while they're seeing somebody, and you got to get them connected, and you don't want to put them on hold, and you disrupt your processes. So phone can be kind of a bad way to do things. What we hear about from savings with SecureMail, we've reduced phone traffic by 30%. That's pretty good. One clinic also reduced the length of their phone calls by 45 seconds. 45-second reduction is pretty good. So we hear improved patient access. We talk about saving people time on the phone by just sending out templated SecureMail reminders. There's a template already in your SecureMail account for appointment reminders that you can edit and resave for your own purposes if you want to, if you don't want to use the one as is. And then staff retention goes up because people aren't being disrupted. They're not doing this tedious work of making phone calls all the time. And we've seen clinics who have directly correlated SecureMail adoption to an increase in staff retention and staff satisfaction. I want to move along quickly here to talk about email. And Candace, feel free to chime in, because obviously email is a big privacy risk and threat. It's how ransomware gets in, which is a bigger issue than we would like it to be. Spam messages often make messages missed. And that's not just in our inbox, but when we're sending stuff, if we're sending stuff to patients, we're combating all the spam that they get, all the mailing lists they've signed up for that we might get lost in. I myself have lost emails because of that. We need to be thoughtful about what channel we're using and how we're going to be seen or read or heard. in that channel and what clutter we're up against. Candace, I mean, you know more about like email interception, hackers trying to grab patient information, all that kind of stuff. You can see in this diagram that its email is not traveling a secure means. All these little dotted lines mean it's accessible to people who are watching. So how does that impact compliance?
Yeah, that's a scary thing, actually. It's interesting that the Health Information Act talks about data being encrypted at rest and in transit when it is health information. And we can see clearly from this that email doesn't qualify because it travels across the open internet. It can be intercepted at any point. You know, people with bad intentions can just snatch your information from the web as it's traveling from one place to another because it isn't a secure method. So that definitely plays into compliance and why the OIPC considers your basic email to be far from compliant with the Health Information Act.
We'll move on to the poll question here. Just let us know. And again, anonymous, no judgment. If you're going to use email to communicate with patients, I mean, you know, there's loads of stories about people sending email to the wrong recipient. That can't be recalled. There's the story, you know, the big one in Calgary a couple of years ago. The doctor's Gmail account was hacked. There was 7,000 patients connected to that email account. You want to make sure that email is really not causing a risk in your clinic. So let's look at here and see what the results say. Invoice and receipts. You know, Candace, talk a little bit about invoices and receipts in terms of patient information.
So invoices and receipts, least amount of information possible is always what we recommend. But if you think about it, it's going to have at the very minimum the patient's name and your clinic name, and you know, likely how much they paid or how much their insurance paid for your services. So all of those things are health information. The fact that it's connecting your patient to your clinic, you know, say you were an AIDS treatment clinic or a cancer specialist, and then that patient's name is associated with your clinic, that alone is considered health information. So it's really not a compliant way to send invoices and receipts, even though we think that it has no sensitive information on it. The fact is that it does.
I'll talk about some of this stuff, and Candace, I know you know how prevalent this is. You work with clinics regularly on privacy incidents that we had to investigate, so you have a couple examples. The big number here for me is that last year, 60% of organizations in Canada, this is from quite a large survey, had to use their cyber incident response plan in the last year. What that means is, one, you should have a plan. If you don't have a plan, get one, make a plan. And then if you haven't used it yet, count yourself lucky. And by the number of 60%, you can expect to use it in the next couple of years. And the cost of a privacy breach when you're using email, fax, anything else, the average ransom in Canada, so if ransomware gets in because somebody in your clinic clicked on an email that had ransomware attached to it, or it comes in through a fax or some other that has been done before, you can expect that these criminals will be asking for $60,000 minimum to get your information back, but really what they're saying is so that I don't release your information on the internet. Most businesses that suffer a ransomware attack say that $60,000 is not the biggest cost of the attack. It's actually trying to fix the problem, working with IT, sending out notifications. If you're using email, for example, to send patient information, and that's what happened, and your privacy impact assessment says you shouldn't, or the privacy commissioner says you shouldn't, or HIPAA says you shouldn't, there may be fines associated with that. All that kind of stuff starts to add up pretty quick. And 90% of attacks or privacy breaches in healthcare even cause loss of productivity in business. You now have people trying to help clean that up, doing the investigation. They're not doing the work of running the clinic day to day, and now you're falling behind in what you're able to accomplish. That's, you know, internal resources, IT hourly rate, that kind of stuff. Candace, I know you've worked with a number of clinics to try and mitigate some of this stuff. What have you seen?
Yeah. So one clinic that I know of recently that had a ransomware attack, they were actually asked for $100,000 US from the hackers, which is just outrageous when you think about it. But what ended up happening is this clinic said they didn't pay the ransom, but they said that the cost of replacing all of their computers and software was the biggest monetary expense. They were smart enough to have had an external encrypted backup as well, which thankfully allowed them to be back in business within a couple of days. But just imagine the cost if they were out of work for longer than that due to lost information, you know, no scheduling, no patient contact information, no health history. So it could easily ruin a business.
Yeah, yeah, that's great point. We'll move along quickly here. So when we add up all of the savings that we looked at, we talked about from a monetary value base level, if you're hitting some of those averages, if you're not, you know, take a look, track your spending on stamps for a little bit and see how that actually comes out. Because what we've seen with the clinics is everything that you mail could be a secure mail message, and that cost now goes away. So clinics that are doing that, if you're hitting around the averages, you're going to save at least $5,000 a year for $400 to $500 a month. And when we get into soft cost savings, what we've seen adding up is we can save staff, I think actually 4.5 hours a week is conservative, a half hour a day. That adds up to 225 hours a year, which is pretty good. We're refocusing staff time, and it comes back to that staff satisfaction, the clinician satisfaction, the patient satisfaction user groups that we've done, that really as a clinic we can increase our performance because we're getting more value from our people, and as people contribute more, they actually contribute more. So the more productive people are, the happier they are, the more creative they become in their job and what they're contributing. There's lots of science behind all that stuff. We actually get increased patient attachment and satisfaction, so it's tough to put a monetary value on that. I've seen stats that put increases in patient satisfaction over time to add hundreds of thousands of dollars to a clinic's revenue. And then depending on privacy incidents that may happen because of fax, because of mail, because of email, you're probably looking at a minimum. Candace, again, you know more than I do on a day-to-day, but even just an easy, simple incident that might not even require reporting, you're gonna spend a lot of time figuring out. Is that fair?
Yeah, and not even just the time, but the amount of stress that people go through when they are trying to figure out how bad the breach is. You don't want to add that stress to your life. So anything you can do to prevent that is better.
Yeah, definitely. And then, you know, we've worked with clinics who have certainly been on the hook for $300,000 or more. We've talked to clinics who got hit with a ransomware attack, and before they paid the ransom, they had spent $500,000 on trying to fix the problem. So lots of opportunity to bring your overhead down and prevent additional costs in the future just by implementing secure mail in some simple ways in your clinic. If you have questions about how to do that, the support team is always on standby. I will address 2 questions very quickly. One note here is that we find many of the medical offices we refer to only accept fax for referrals. That's something we hear, and we do know, we talked about last time, faxes are going away. Lots of jurisdictions are pledging to get rid of that. Some of the information around this, how much is fax actually costing you, that's information that clinics are starting to find out. The story like Greg Price, lots of those that indicate why fax should go away. And Candace, like you said, we take it for granted as compliant, and it really isn't. There's one hospital network in Ontario that over the course of a couple of years had over 2,000 breach incidents related to misdialed faxes. That's one organization. So they've now gotten rid of fax. Clinics that hold on to those ways tend to fall down in the referral pile, and I know sometimes we don't have a choice. I know we have a lot of specialty clinics that do only accept secure mail. They won't take fax anymore. They won't take email anymore. So the change is happening. It's slow. As a subscriber to Secure Mail, you can invite anybody to have their own free account. You can explain to them that it's cheaper, it's easier, it's faster. We saw that 3/4 of clinics are using paper fax. We're printing stuff so that it can be printed again and then it can be shredded. So we're causing a lot of problems. We're in a state where healthcare is up against the wall from a fundability standpoint, from a sustainability standpoint, and all of these things add up to cause problems for the system. And then one more question that we'll address quickly, and anything else we'll send out later on with answers. But what about secure messaging included in our EMR or our practice management software? So some patient records management systems have a secure messaging feature. Candace, have we worked with any of those, or what are your thoughts generally on that kind of thing?
So I'm always hesitant to recommend, any vendor, whether they're compliant or, to say whether they're compliant or not, because the truth is that these software companies are constantly updating and changing. But if your EMR does have a secure messaging module, you just want to look into it. Maybe look on the OIPC's website of accepted PIAs and see if their secure messaging is mentioned in there at all, because that means that they have been measured against the HIA and found to be compliant. But you just do your research. That's kind of all I can say. Make sure they've got auditability, and that all of the information is encrypted at rest and in transit, and just do the best you can to make sure that they are compliant.
Yeah, great points. The other thing that we see is that with these services, they're typically related to one type of communication. So they may work with patients. Sometimes they're one way with patients, which isn't great. We're trying to be patient-centric. That's not going to cut it. But they're not going to necessarily work with other providers. So now you've introduced a new channel of communication that's not inclusive. So with something like Secure Mail, you can use it with everybody. So you can replace your fax, you can replace all your mail, and you can replace some of your phone with one solution, as opposed to adding another one that's not going to work with everybody. So it just complicates things and adds a little bit more complexity, is what we've seen working with clinics to help overcome some of those inefficiencies that they're experiencing. Candace, thanks so much for your time and input. Really valuable stuff. Thanks again, and have a great rest of your week.